Hi everyone, welcome to Imaging Study. Today we are going to see a case of midline prostatic cyst. This is a very common finding while practicing ultrasound, but there are some tricky parts that you should know before diagnosing this thing. A 38-year-old male patient came for a routine abdominal ultrasound scan. Let's see what we have got on ultrasound. Here is a picture of the prostate in transabdominal ultrasound on transverse and longitudinal sections. You see the volume looks quite normal no matter how you measure it. But at the center of the prostate you can see an anechoic area which should be a little carefully observed on real time. Let's see on real time. Here's the transverse section of the prostate. You can see a well-defined round anechoic cystic structure at the midline. You can see postureo-acoustic enhancement here also, as this cystic structure is tiny, so the enhancement also should be tiny. Now let's magnify the image. You see, on magnified image, the cystic area is quite well visualized. The wall is thin and it is round in shape. There is no adjacent parenchymal abnormality. The adjacent urinary bladder wall is also not thickened. Now when you see this type of cystic lesion on transverse section, you always should evaluate it on longitudinal section. On longitudinal section here you can see the cystic structure is still anechoic. A common differential diagnosis of this case is the urethral obstruction due to urethral stone or any other thing. At that time, you will see this cystic area will get linear on longitudinal section. It will extend from the urethral orifice up to the site of obstruction. So here it didn't happen. And also adjacent urinary bladder wall is important. If it was due to the obstructive cause, the wall may get thickened due to the inflammatory process, which didn't happen here also. So this is nothing but a prostatic cyst. Here's the picture. You can see this cystic area at the prostatic parenchyma. It is situated at the midline. Here is again 3 pictures with the prostatic cyst at the midline. Now it might be due to the vascular abnormality, which is extremely rare. So we put color Doppler. We always suggest you to put color Doppler if you see any pathology, no matter what is the finding, but you should know what is the color Doppler finding of that lesion. So on color Doppler, there is no vascularity, no adjacent vascular abnormality. You can see the ureteric jets here also. Here's the still picture of color Doppler with no aberrant vascular flow. And obviously the cystic structure is not a vascular abnormality. The lesion measures around 6 mm in diameter. So in summary, a midline well-defined round anechoic cystic area is noted within the prostatic parenchyma, indicating a midline prostatic cyst. Now the take-home message. When you see a midline prostatic cyst, 2 differentials come. One is the prostatic utricle cyst and another one is the Müllerian duct cyst. Both look similar on ultrasound, so it's a little bit difficult or impossible to distinguish between them. Usually the prostatic utricle cyst communicates with the urethra and may contain spermatozoa on aspiration. We try to differentiate or suspect the exact diagnosis on ultrasound considering the age of the patient. If the age is first or second decade, we go for the prostatic utricle cyst primarily. If the age is around third or fourth decades like this patient, we usually try to focus on Müllerian duct cyst. Thank you for watching this video. Don't forget to subscribe our YouTube channel and try to follow us on other social platforms. See you on the next one. Have a nice day.